This will undoubtedly be one of my favorite videos. It's about QNRT, quantum neural reset therapy, and adopted kids and adults. So I'm going to take you through 3 cases. I think you'll find it fascinating. Now, one of the most important things to keep in mind here is that QNRT resets the subconscious brain. And because we're dealing with the subconscious brain, you do not have to have conscious memory to get the brain to reset and to function better and see improvements in quality of life, both in terms of mental improvements, emotional improvements, physical improvements, and so on. So I'm going to take you through 3 cases here, a 10-year-old, a 14-year-old, and a 33-year-old. So for the 10-year-old, it was really hard to make decisions. They really worried a lot about the decisions, if they were making the right decisions, and they would get super upset and stay on it for days. If they got upset, they would stay on it for days. They couldn't let go of whatever they were upset about. It would go over and over and over and over for days. And then there was just a lot of emotion about being adopted. So we did QNRT. We were also doing neurofeedback, which is computerized brain training. We were working on the balance in the frontal lobes and the balance in the midbrain, which relates to anxiety. So our first reset went to emotional heart. That's deep connections between the heart and the brain. And it related to doubt and uncertainty and feelings and desires that were equally important, and being adopted does not define me. Being adopted does not define me. So that's what adopted kids often feel. So the next reset was at birth. Again, we do not have to have conscious memory, and the reset was about it was also an emotional heart, no longer triggered by if mom would want me or if I should be in a different family. If mom would want me or if I should be in a different family. Big stuff. We had another reset or 2 that wasn't related to adoption, but was related to the brain's health. And then we did emotional heart again and said, I can feel and express what I feel inside. It's satisfying to create deep connection with others. And if I disappoint mom or dad, or teachers, I can let go of it. I can let go of it and move on. And then we had another reset, which was a core driver reset, which is defective belief patterns, in this case, feeling like a defective child. And that was about letting go of feeling it's always my fault if things go wrong, and letting go of why am I here, and is there something wrong with me? So important to reset faulty belief patterns like that. Again, those are core drivers. Then we were back to an emotional heart reset at 10 years old at the time now. Frustrated and disappointment, taking me through a roller coaster ride, meaning just I can handle frustration and resentment, or frustration and disappointment better. And then we had another reset that was conception to birth, letting go of birth mom's stress that made it hard for me to say no. The child couldn't say no about anything. And then another reset on around 3 days old, letting go of not knowing where I belong, And this was so powerful for this child, that such big changes. He could feel confident after getting QNRT. He could feel comfortable in his own skin, and he could feel comfortable with his adoption. And his schoolwork improved, and his home life improved, and all kinds of wonderful changes. Now let's talk about the 14-year-old. The 14-year-old was adopted out of another country. I don't want to get too specific, but didn't have great medical care probably in those first few years, and adopted at about 2.5. So their big challenges were task completion. They couldn't follow a routine in the morning no matter what. I have to have like dozens of reminders to follow this routine. They always wanted others to play their way and no other way. And then they struggled a lot to communicate feelings. They just really couldn't say what they were feeling. And then emotions could easily escalate from a low level to a super high level very, very quickly. There was a lot of trouble with the tracking of the eyes. If they would follow my pen, the eyes would flutter like that. It's called nystagmus. Again, that was due to some of the early life changes. Again, I don't want to be too specific here, but there was a lot of nystagmus as we worked with this child. The nystagmus improved significantly. The eyes were almost normal in behavior. So we chose, instead of neurofeedback, we chose to do cerebellum exercises with this child because of the eye movements or eye nystagmus. Again, when they were following a pen, their eyes would flutter like that. So we chose to do cerebellum exercises. So I had my staff doing special exercises that we do in our office. We put a headband on the child, and then there's a laser pointer in the headband, and their job is to move their head along these diagrams. And that's just one of the several cerebellum exercises we do with them. And again, the cerebellum sits back here, deals with balance, coordination, movement, and muscle tone. So here's how the resets played out for this young lady. The first reset was at ages 1 to 2. Again, because we don't have to have conscious memory, we can test the word phrases and zero right in on what was going on. So this was about rejection, feeling unsafe and unprotected. And then the next reset was from 2 to 3 years old. That was about feeling unsure, unbalanced, and unsafe again. And then the next reset was what we call a miasm, which is a triggering of expression, of health expression. This one resulted around judgment, feeling judgment and sentence, and it related to a lack of understanding about my story, what's expected of me, what's the next thing, and constantly judging myself. And then the next reset was in the first year. Again, it was a miasm adjustment related to health expression. The words were forget and walk out on. And that, of course, biological mom, forgot them and walked out on them. And so that was what that reset was about. And then the next reset was birth to 6 years or 6 months, birth to 6 months. And I no longer need to self-soothe to feel safe and sure. So this child was doing a self-soothing motion with their hands on their face. And that was getting that reset that they don't need to do that because now they can feel safe and secure. So again, this child post-care could handle emotions better. They could follow a routine. They could get back into a routine when there was a school break quicker. They could process their emotions better. They could give feedback on their emotions better. Their EEG improved. And I'm telling you, visually, this child is an entirely different child. When we saw her like a month or two after we finished the main part of care, entirely different child. You could just see it on their face. So exciting for them, so exciting for the family, and we're so excited to help. Now here, we're going to look at a 33-year-old, as I mentioned, and this person has an autoimmune condition. I don't want to spend as much time on the autoimmunity part of it as just the how the adoption part relates in here. So we know that there's tons of connections between early childhood trauma and autoimmune disease as an adult. I've covered some of those in other videos. There are about 4 to 5 research papers, including the ACE studies from the Centers for Disease Control, about childhood trauma and autoimmune disease as an adult. So this person had an autoimmune disease similar to MS, where the immune system would attack the optic nerve and they could lose their vision. They were pretty stable in the last few years, but one of the triggering stresses based on QNRT was finding birth mom, not getting the whole story from birth mom, and so forth. And then that helped trigger autoimmunity along with some infections, specifically influenza. So the first reset went to overwhelm of finding birth mom, not getting the full story, letting go of not having the full story, and this throwing me off track. And then the second reset went from birth to 1, and getting more of the story, but it was a rough story. I don't want to repeat it all here, but a very rough story, and feeling unwanted and letting go of this, putting a mark on my life. Letting go of this, putting a mark on my life was what we reset the brain on. So this is an ongoing case, and we'll be seeing this person back in a few 6 weeks or so. We're looking forward to continuing to work there, but that just gives you a little bit of an idea, without disclosing too much information, about how QNRT shows up for adopted kids and adults. It's a very, very exciting work. It's thrilling for me to do it and see so much improvement in both children and adults. So I thought I would go over 3 cases like that. I think you'll find it fascinating. I would ask you to share this video, get the word out there, because this is something that is unlike anything else, especially when you don't have the conscious story, that we can get the subconscious neurological story and reset the brain and help it function better. And in helping the brain function better, we see mental improvements, we see emotional improvements, and we see physical improvements, like with autoimmune issues and more. So I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined. I'm a master practitioner of QNRT. There's only 3 in the country in addition to the developer of QNRT. And so we do see people from multiple states, 28 states so far. And so people fly in for a series of QNRT, and we look forward to helping you if this is something you're interested in following up on. Again, Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.